We are here on MCA TV with Professor Hecher. Welcome, Professor. Can you tell us something about the neurologic outcome and follow-up of twins after TTTS?
So nowadays for twin transfusion syndrome, the most effective therapy is laser therapy, where we coagulate all the communicating vessels on the surface of the placenta. And this is very effective in terms of survival. If you don't do anything with TTTS, 80 to 90% of these fetuses would die. Nowadays, 80 to 9% of fetuses survive if you do a laser therapy. And now the question is about their quality of survival as well. So it's not just mortality, it is also about morbidity. And therefore it is very important to have studies which look at the follow-up and the neurodevelopmental follow-up of those survivors. And the good message is that this is also significantly better than with the previous therapy, where we could only drain amniotic fluid if there was too much amniotic fluid, which is one of the main features of TTTS. Then we could drain it, but we could not cure the disease because the underlying vessels were still open. And therefore, with the laser therapy, we now have a causative disease. And we have a causative therapy, and the good message is also that not more fetuses survive, but the neurological impairment is much lower than it used to be with repeated amnio drainages. And now it is about 6 to 8% severe neurological handicap after laser therapy. And what is also very important is that it did not increase with the increase in survival rates, because what we would expect otherwise is that if more children survive, the sicker ones survive as well, and therefore they may have an increased rate of neurological damage, which is not the case. And this is a good message. And this is very important.
Thank you. Thank you.
Pleasure.